Hello, and welcome to the Outbreak procedure video presented by Tri-County Health Department. This video is for you and your staff to refer to when you've discovered an outbreak is occurring at your center. You'll want to make sure you call us right away. In the meantime, here are some steps to take to start off on the right foot. As stated, the first step is to call us. Communication is a very important part of the process, so you'll want to call us as soon as possible. If your sick log shows an increase in students and staff with similar symptoms, or anything out of the ordinary, immediately contact your health inspector or dial our main number. Letting us know you're having a possible outbreak does not mean you're in trouble. We simply need to be notified so we can help you prevent more kids from becoming ill. Next, documentation. Document the following in your sick log: children that get sick on site and are sent home, children that are called out sick, staff that call out, or staff that go home sick. Ensure all staff members know their responsibility for reporting illnesses in their classroom as well as their own symptoms. Your disease specialist will want to see your sick logs to help determine how the outbreak is spreading. Exclusion of sick children and staff. Begin evaluating the children and staff to determine who is sick. Individuals with symptoms such as diarrhea and vomiting need to be excluded from the facility. This includes your kitchen staff. Make sure you have a backup to cover kitchen duties in case the main cook gets sick. Tri-County Health Department will help you determine how long people need to be kept home depending on their symptoms. At drop-off time, screen children by asking parents if the kids have had any symptoms. Ensure that kids that get sick at the facility are separated from other children by placing them in the designated ill child area. Move other children away from the incident, preferably out of the room, until staff can clean up the accident. Also, make sure you don't mix different age groups or send kids to another child care center, as this increases the chance the illness will spread. Hand washing. One of the most important things you can do to stop the spread of illness is have everyone wash their hands. Have staff and children use warm water and soap and scrub for at least 20 seconds. Important times to wash hands include arriving at the center, after using the bathroom, before eating, after playing on the playground, or when hands are visibly soiled. Remember, staff must wash their hands when diapering a child and need to make sure to wash the infant's hands as well. Sanitizing and disinfecting. Disinfection procedures may need to be changed during an outbreak. Verify your product needs with your inspector. Sanitizing of toys and tabletops needs to occur at least once a day in all classrooms during an outbreak. Surfaces that come into contact with vomit and diarrhea need to be washed, rinsed, and disinfected. If that surface could go into a child's mouth, such as a toy or the table they eat off of, it also needs to be washed, rinsed, and sanitized. We want to make sure the disinfectant residue is cleaned off of the surface. During an outbreak, restricting certain activities can stop the spread of illness from person to person. In general, all types of water play need to be stopped. It is also important to remove all soft toys from the classroom or items that cannot be thoroughly washed, rinsed, and sanitized, such as art supplies and books. Family-style meals and sensory play such as Play-Doh should also be discontinued during an outbreak. Moving forward, your inspector and disease specialist will come to your facility to conduct an inspection to make sure disease prevention procedures are being implemented. Remember that kids do get sick at times, and outbreaks in childcare facilities are common, but you won't be managing an outbreak on your own. Your Tri-County inspector and disease specialist will work with you closely to help stop the spread of illness and put additional disease control measures in place. Following the steps in this video is a great starting place for managing an outbreak in your center. Thanks for watching, and make sure you follow these steps and policies for an outbreak response. Call us or visit our website with any questions you might have regarding these procedures.